My name is Aziz Ahmad. I'm a consultant spinal surgeon and I'm currently working at Oaks Hospital. My specialty is spinal surgery and I look after people with neck pain, back pain, and I offer a full range of spinal treatment. So cervical myelopathy is a complex term, but essentially what it really means is that the spinal cord is abnormal and is not functioning normally. So spinal cord is a structure which is an important part of your body, and it transmits all the commands from the brain to your hands and limbs. And part of this job is to basically coordination and allows you to move your hands and feet in a particular way. And once they start becoming abnormal due to some either compression or disease, it is called cervical myelopathy. So cervical myelopathy is a very poorly understood condition and is very difficult to diagnose because it does not have any telltale sign. People usually complain of numbness in their hands, dropping things, becoming clumsy, having issues with walking and mobility. And myelopathy really affects people in their late 60s and 70s, and that's the age when people think that they're getting old, and that's the reason why they have got this issue. So it's not very uncommon for us to see a very late case of cervical myelopathy because for the last 2, 3, 4 years patients have just put it down to being old age. So it's quite important to get early diagnosis because spinal cord, the function you lose generally does not recover. So even when we diagnose spinal cord dysfunction or myelopathy and we offer treatment, the function which has been lost is generally lost. For example, if you have lost to a state where you're walking on a stick, then even after surgery you're likely to be still using the stick. And in my practice, it's not very uncommon to see people coming even up to wheelchair. So it's very important to raise awareness of this debilitating condition, that this is a progressive condition, the treatment is available, but it is really important to come and seek help because the function you lose may not get better even after successful treatment. Yes, so there is a treatment available for cervical myelopathy. As a spinal surgeon, we do quite a lot of operation for people who have diagnosed with this condition, and we can relieve the pressure on the spinal cord. It helps to stop the progression of the disease and the people do not deteriorate further. And as I said previously, because it's only stops the progression, it doesn't always reverse the function lost. It is quite important to get these diagnoses early. So if you are suspecting that you're having issues with balance, mobility, you're falling down or having numbness in hands and feet, then it is very important for you to speak to your doctor and discuss that whether this is a cervical myelopathy, or you can even come to see a spinal surgeon and we can do a full assessment of your neurology, go through your history and see whether you have got this debilitating condition or not.